Hi, I'm Dr. Suvarchalaa, Scientific Director with ZIVA Fertility Centers. Embryo freezing, also called as embryo cryopreservation, is a procedure where embryos created by the procedure of IVF, in vitro fertilization, or intracytoplasmic sperm injection under assisted reproductive technologies are frozen at very low temperatures for future use. There are many reasons why we perform embryo freezing, and a few of them I wish to discuss with you. The first is fertility preservation. Couples undergoing IVF treatment may have surplus embryos after a fresh IVF cycle. These embryos can be cryopreserved for future use if the initial IVF cycle is unsuccessful or if the couple wishes to have additional children later on. Next is medical reasons. There are some conditions where individuals or couples may choose embryo freezing due to medical reasons such as cancer treatment, which may impact fertility. For example, when women undergo chemotherapy or radiation, they may opt to freeze embryos before treatment in order to preserve fertility. They freeze these embryos, go through chemotherapy, radiation, or any procedures which are important for life saving, and then when they are absolutely alright, they come back for transferring of these embryos into the uterus and becoming parents. Next is genetic testing. This is a very important reason why we preserve embryos. Embryo freezing allows for possibility of performing pre-implantation genetic testing on embryos before transfer. This procedure can screen embryos for genetic abnormalities or chromosomal disorders, reducing the risk of passing on genetic diseases to offsprings. When there is a suspected reason for genetic abnormalities, or when the maternal age is high, these are few instances why PGT or pre-implantation genetic testing is performed. Under such circumstances, the embryo is frozen, results are awaited, and then when results come back stating which embryo is normal, the embryo transfer is performed. Next reason is synchronization with the menstrual cycle. Sometimes when a lot of eggs are retrieved or even a few eggs are retrieved, embryos are formed, there is asynchrony between the embryo stage, the grade, and the quality of endometrium. So when we see that there is a mismatch, there is a high likelihood that the embryo will not implant or stick to the endometrial lining. In such cases also, embryos are frozen. In a subsequent cycle, when the menstrual cycle is synchronized with the embryo day and stage, embryos are transferred back into the uterus for a higher success rate. Next, embryo freezing is also performed for mitigating ovarian hyperstimulation syndrome. In some circumstances, ovarian hyperstimulation, also known as OHSS, may occur during an IVF cycle where the ovaries become swollen and painful due to the stimulation of multiple follicles. Embryo freezing allows for the postponement of embryo transfer to a later stage where optimal timing and reduction of risk of OHS is seen, and then the embryos are transferred back. So OHS also is a reason why embryos are frozen. Next comes the case of embryo freezing for donation. The law states that donor eggs, donor sperms can be taken to create donor embryos and can be frozen for a patient, especially in cases where eggs and sperms are compromised and the patient wishes to go for embryo donation. Under such circumstances also, embryos are frozen. Then there are ethical and religious considerations also. Some individuals or couples may freeze embryos due to ethical or religious beliefs. Embryos freezing allows them to store embryos for an indefinite period without the immediate need for transfers. Overall, embryo freezing offers individuals and couples flexibility, control, and the opportunity to optimize their chances of achieving a successful pregnancy while addressing various medical, ethical, legal factors, and however increasing the chance of pregnancy. If you wish to know more about this, please feel free to contact us. Thank you.
A lot of effort has gone into making this video. Please like and subscribe us. Thank you.